and they don't need hands-on, we'll be able to provide this video to the staff for viewing. So today I will be going over the telehealth connectivity, the provider acknowledgement, and the informed consent for consultation form, as well as connectivity and the cameras that we use here at the PDP. So the first thing I want to talk about is telehealth and the purpose of it. We installed telehealth across the PDP campus at all of the sites. Our last remaining site we're working on is JJSC, but all other sites have been tested and are connected and functional. So they've all been tested, and we are able to use telehealth services between each of the facilities from facility to facility. Moving forward, there will be other uses for telehealth. However, for this training, this is for typically for after-hours providers, and in lieu of them going to a facility, they can do a telehealth session if a physical evaluation is not needed. If a physical evaluation is needed, the expectation is that the provider, say is at CFCF, would have to go to the necessary site to provide that physical evaluation. But if no physical evaluation is needed, they'll be able to use the telehealth services. We will be planning some training for the nurses, since typically it will be a nurse, RN or LPN on one side and a provider on the other side, but we wanted to get through the provider training first. So the first thing I want to show everyone is the cameras. When I was out at the different various sites, I noticed that the cameras that I put on top of the monitors were put face down in different areas or unplugged completely. I understand that some people are weary of the cameras, but I just want to explain that whoever can view my screen, we're using an HD Pro webcam. It's called a C920, and it looks like this. It's black, kind of rectangular oval. And if you look on the two sides of it, you'll see no colors. So what I want to show you is when the camera is active, you will see, I'm going to pull it over here, you will see blue lights light up. This means that you are in the Polycom software, you have turned on the camera, and the video and the microphone is active. So if you don't see blue lights on either side of the camera, it is not on, and it is not displaying video to anyone else. So I understand that there still may be people who put tape over this, but tape could possibly ruin the lens, so I advise against it. So again, the blue lines on both sides mean that the camera is active and displaying video to either you or to the person you've connected with. What just happened? And can everyone still see my screen? Okay, I'll see. I'm sorry?
It's blank.
No, Joe, I'm not seeing it.
Oh, someone clicked on whiteboard, Tamika.
I didn't mean to if I did.
Okay. All right. Can everyone see the screen again?
Yes, we can see it. Thank you.
You're welcome. Okay, so this is the camera, and like I said, if there is no blue lights, it means that it is not transmitting video, and if you see blue lights on either side, on both sides, it's not one, it's always on both, it means that it is active and taking video. So the next thing I would like, does anyone have any questions about the actual hardware? Okay. The next thing I want to go over is the telehealth instructions that we created, and it was created in the format that we use for our workflows for eClinicalWorks so that it's consistent with our instructions. And everyone will see on their desktop an icon that says Polycom, it's right here, Polycom Real Presence Desktop. These icons are only on the workstations that have the Polycom installed and the webcams installed. So you could see here in this instruction sheet that I provided, and I can email it to everyone. The locations of the Polycom workstations at PDP are as follows. ASD Central Unit Triage. It's actually in the small doctor's office to the left of the triage area. In Triple C's, it's in ASD is the Central Unit Triage, so it's the only exam room in ASD. In Triple C's, it's in the doctor's exam room, the small exam room to the left of the medical triage room. In CFCF, it's in doctor's exam room number 3. I believe that's the chronic care exam room. In DC, it's in the triage evaluation room. I believe that's where all the nurses do RN sick call. In HOC, it's in the doctor's exam room, which is if you're walking into HOC, it's the big room to the right where Dr. Arnoon is, and it's actually the computer next to his, the one that typically the MA is using. In JJSC, it will be in the doctor's exam room. In PIC, it is in Dr. Seguria's office, which is right across from triage. And in RCF, it's in evaluation room number 248. I'm not exactly sure if that's 1, 2, or 3, but the rooms do have numbers on them in each of the facilities. Based on, we will roll this out. If there is a need for additional locations, Brandon DeJulius did ask me if we could add workstations, and I said yes. If we work with MIS, we can add additional locations. So depending on the usage and volume, and if we expand the usage of this, this list could potentially expand. So the first thing I want to go over is the connectivity. And as I told you, there's a Polycom Real Presence desktop on the workstations that have the webcams and the software installed. You cannot move the webcams and request the software to be installed on a different workstation without working with my team and MIS. The workstations that these webcams have been installed on have been set up specially by the MIS team, and they're allowing the software to be used. They're allowing the webcams to be used. So if for some reason there's an issue with the current locations of the Polycom and the webcams, you will have to reach out to us, let us know what the problem is and where you would like to move the equipment, and then we could reach out. We can work with management and the MIS team to make the necessary changes if there's a need. So unfortunately, again, because of how the connectivity is here, I can't show you the live software demo. I'm going to just go through the instructions like I did during the provider meeting. And after you click on the Polycom icon, a box will open up. I actually can show you that box. So when you double-click the Polycom Real Presence desktop, it will load up. It will tell you that it's initializing the settings. And you'll get the Enterprise Sign-In. So when you get the Enterprise Sign-In, you'll click the Enter button, which my connectivity is not working, like I said, because of the connectivity issues. And you'll just click on the Enter button. When you get the email spot, you will type in networkoperations@horizonhealth.com, and then you will click the next button. From that screen, you will get a login screen, and this login screen differs per facility. You will enter the username at the facility that you're working in to connect to the Polycom. So if you're working at ASD, you'll enter the username PA-PHIASD-TMED, and the password for everybody is the same. So, again, if you're at ASD, you'll use ASD's credentials, because then if you're calling CFCF, they'll use their CFCF credentials. Once you do enter this information in your profile, it will save at that site. So if you utilize the software at, say, CFCF, and you go back to CFCF and log in, these credentials will save, and that we don't have any plans to change any of the usernames or passwords. So typically speaking, when you set this up, you will only have to do it once, and then once you go into the software, if it's needed, it will sign you in. So once you click Sign In, it'll bring you to the desktop module, and this is what it will look like. When you first log in, like I said, the camera will turn blue on both sides, and you'll see your video that you're recording or not recording, you're displaying. It's actually not recording anywhere. It's just a live video. It doesn't record the session. So you'll have some different things on this screen when it opens up. The first thing is the blue square with nine squares, which is the dial pad, which would allow you to dial an extension. In terms of an extension, it means the PC that you're calling. We won't use that. If you guys get really well versed in it and you want to, you'll be able to. You'll see that down here is the extension. So if you're on the phone with DC and they tell you their workstation number and you can quickly type that in, you would be able to use that to call them. The recent call log is this little clock-looking thing, and that would just show you the history of the calls that you made in your profile. The last thing is what we'll pretty much use. It's the Horizon Global Directory here. And so if you click on that, what it would do is look similar to this white box here, and you would be able to search any of these site usernames. So when you type in PA-, what you'll get is the list of all the PA Telecom usernames. So you won't even have to type in the whole thing. So say I'm at ASD, I've logged in, I'm the nurse, I have to call CSCF. So ASD, I'm going to go down to this directory, type in PA-, the list of the usernames will come up. I would simply select the CSCF username, and then you'll click the bottom call. Okay, does that make sense to everyone? All right, so when you call, the remote workstation at the other site will ring, a box will pop up on the workstation, and the user has to click accept the call. It won't just automatically answer the call. That's just how the settings are. We don't have any expectation to just automatically let people remote into the other workstations. There has to be communication. Someone has to be there with the expectation that you're going to communicate with each other, and then you can do your telehealth session. Just for informational purposes, again, this is the workstation ID. For this example, it's 661003. In terms of that number, it identifies exactly with the PPS property tag number on the actual computer CPU or box, wherever you want to call that box. It's a CPU. If you needed to go back into the login screen for some reason, you could always click this back button over here to the bottom left. So we have the dial pad when you get well versed in it, and you could potentially just call the workstation by number. We have the recent calls to show the recent calls that were made from that workstation in your profile. Then we have the directory, which, again, will be pretty much used definitely from the beginning. And in the search box, you'll be able to type in PA, and it will pull the list of the users available. And I'm actually not sure what this chat thing does because we won't be using it. Oh, so like I was just talking about the global directory, you can search the box. It will tell you your options here, and then you can click the call button, and this is more instructions for the dial pad. So that's the connectivity, and unfortunately, I can't show you the live settings. I know we all like to see things live because it will give us a better feel and make us comfortable, but I am unable to show you that. For this training, does anyone have any questions about what I went over for the software and connectivity and how to locate the calling or receiving recipients? Okay, so Tamika did email out the provider acknowledgement.
Oh, Joe?
Yes.
Sorry, I had a question. When we start this with the Temple program, how's that going to work?
I'm not sure how that's going to work. That's what I mean about expanding the use of it. Right now, I've only tested site-to-site connectivity. It will expand to using it with Temple Health, and it will expand to the staff who is attempting to schedule inmates for different public services. So when Temple is ready, I'm sure I'll work with their IT team we will provide instructions specifically for dialing Temple or any other place that's outside of facility. So I don't have the information for Temple, but when Temple is established and we are ready to start telehealth communication with them, I will work with their team to do testing, and then I'll provide all the necessary information for the bidirectional call to occur.
So right now, is it mainly for the providers that are on call?
It's mainly for after hours when, say, there's only one provider at CFCF and there's an issue that does not require a physical evaluation. The provider can do a telehealth session and work with the nurse and the patient to provide care.
Yeah, but now the only question is that you say not need an exam, but sometimes you can tell by looking, like if the nurse says the guy has an abscess. So after you see it on the camera, you might say, oh, yeah, I have to come over and IND it. So that's a case where you are seeing something on the video that prompts you to say that you need to go over or you don't need to go over, depending on...
Exactly. So it could start off as a telehealth call, and then based on the provider discretion, that's a scratch from a nail, that guy's fine. I don't need to come over and see it. Just put a Band-Aid on it and some alcohol. Or, that looks like it's a infected boil that needs to be IND'd. All right, well, this telehealth did indicate that I do have to come over there. So as per your guys' operations and practice, you would then go over to the site.
All right, and then I guess you'll go through the documentation later in the WebEx.
Yep, the next item after this, if there's any additional questions, I'll answer them, and then I'm going to go into the provider acknowledgement, which has to be signed by the providers, and then the informed consent for consultation that the patient has to fill out. Okay,
thank you.
You're welcome. So does anyone else have any questions about the software or connectivity? Okay. So the next item I want to go over is the provider the provider acknowledgement, and I want to get it to one page. Oops, one page. Okay, so it's the biggest I can make it. Basically, this telehealth provider acknowledgement, I read through this, and I don't know if there's an expectation for us ever to move this to providers who are not on site and are at their home, but this basically covers the expectations and requirements of care for completing telehealth. So I'm going to go through the provider acknowledgement. I did speak with Vandalyn. For anyone who's on this call, since this was emailed to you, if you could sign the second copy of this and inter-office it, or if you have an AA who can scan it and email it to Vandalyn, she would like to get this by Friday. So I will communicate with Vandalyn who was on the call and who wasn't, so that people who are not on the call, we'll get them trained and we'll set a deadline for them to get the acknowledgement in. But we're going to go over the provider acknowledgement, and then if you could, on your time, print out and sign a copy and either email or inter-office it to Vandalyn Phillips. All right, so the purpose of the policy is to establish procedures and expectations for providers delivering care via telehealth on behalf of Horizon Health. A lot of these expectations are for providers who are not on site. So if there is a time where we start providing telehealth services remotely, this is where these expectations will most likely come into play. So the procedure is providers who deliver telehealth services, including medical and behavioral health care, will follow the process outlined in this document while conducting telehealth clinic. Telehealth providers who use an approach significantly different from these guidelines shall submit a variance request to Horizon Health Chief Medical Officer, Chief Psychiatry Officer, and VP of Telehealth for review and approval prior to the scheduled visit. In terms of the PDP, if we do expand this, Dr. Clue, I'm sure will review this with you guys again. Prior to submitting any request to this group, I would I would highly recommend having a conversation with Dr. Clue about anything that you see as significantly different, and then he can determine the next steps, if need be, for requesting a variance request. If a variance request is needed, the CMO, CPO, and Vice President of Telehealth will discuss and review this request. So outside of any variance request, the requirements and expectations of care are outlined as follows. The provider will have a professional appearance. This includes business casual attire, scrubs, and a white lab coat. However, white is not a good color in an audiovisual equipment. It may make things foggy, or it may mess with the acuity of the camera. So the good thing is, as a provider, our inmates don't wear white, and our nurses typically don't wear white. So when they're doing the exam, it won't mess with the acuity of the camera, so that you'll be able to get a good, high-definition quality image of the patient and the issue that you're trying to triage. The office environment or setting shall have a professional appearance. Since we're starting this with the PDP, we have our exam rooms in our medical areas, and they should be appropriate for the setting. So just keep that in mind. If the telehealth unit is in your home, care should be taken to keep the background clean, neat, and clear of personal family photos and other items and clutter that would not normally be evident in an outside practitioner's office. As always, privacy, confidentiality, and HIPAA standards apply to telehealth encounters. Pets, visitors, and other distractions should not be part of the telehealth visit. A do not disturb sign should be placed on the provider's door to prevent interruptions and maintain privacy and confidentiality. I did, upon reviewing this, reach out to Vandalin. In HOC, it might be difficult to put a sign up since it's one big area. However, any of the areas that are in exam rooms, we will be making do not disturb signs so that anyone who is attempting to talk to the provider or the nurse knows that there's an active telehealth session going on. So we do plan on making do not disturb signs for those exam rooms. Again, along with that do not disturb, care must be taken to prevent background noise disruptions of barking dogs, ringing phones, pagers, doorbells, loud music, television, or other distractions. The provider shall not eat or drink during the clinic visit. Drinking a beverage between patient encounters is acceptable, but this activity must be kept off camera. The provider will introduce him or herself and explain the reason for the telehealth clinic. The provider will ask the patient if he or she has any questions or concern regarding the use of telehealth. The provider will remain cognizant of the provider-patient relationship within the entire context of the telehealth encounter, maintaining Horizon Health and State Licensing Board standard of care. Discussion with the patient should remain professional throughout the visit. A personal conversation between patient and provider is inappropriate. Federal, state, and other credentialing and regulatory requirements shall be met. The provider shall be fully licensed with respect to the site where the patient is physically located. Horizon Health providers providing health care services shall be required to follow the Horizon Health credentialing policy. Since we're doing this all within PA, everyone has met the credentialing policy. A federal DEA number is required to write prescription for controlled substances in every state where controlled substances may be prescribed. Some states have state-controlled substance licensure requirements in addition to the state-specific DEA and the state medical license. Therefore, providers delivering telehealth services need to be registered with the site pharmacy, including but not limited to providing current DEA number to the site pharmacy prior to establishing site telehealth services. The good thing is here, everyone who has a DEA number and license, the EHR team has received that. It is a requirement for us to establish your account in ECW. So the provider will document the telehealth visit and subsequent orders as per site requirements. So this does include written documentation on an approved standard form or directly into the electronic health record. And all documentation should be provided to the site on the same day as the encounter. So as everyone knows, we have an electronic health record. All documentation will be entered into there. The telehealth provider shall accept responsibility of the patient records wherever the provider is conducting the visit. Records shall remain confidential, private, and HIPAA compliant. And paper records shall be stored in a locked filing cabinet or disposed of safely and securely per HIPAA guidelines. So as per our policy, if there's any paperwork that is manually completed, that goes directly to the medical scan bin, and it is scanned within the allotted time allowed for the medical records to scan during that shift. Providers shall contribute to and cooperate in any reasonable quality improvement and utilization review activities related to the services at correctional facilities. Providers shall retain the right to access utilization data for services delivered. Providers will consistently meet agreed upon consult response time terms identified within the executed telemedicine agreement. Again, that's not something we are starting with. There are no expectations of to complete a visit in a certain period of time. However, depending on future enhancements and projects and timelines, that could be a possibility in the future. Prior to initiating telehealth, the CMO, CPO, Vice President of Telehealth, or designee may conduct an on-site or video inspection of the provider's office. Again, that's more for if you were providing this service from your home. So basically, we would like you to print your name and sign it here, and then email or interoffice or possibly fax that signed document to Vandalin. For attendees on this call, we would like that by Friday. Does anyone have any questions regarding the telehealth provider acknowledgement, which was also emailed to you? Okay. The next thing I want to go over is the telehealth informed consent for consultation. Okay, let me get that view bigger. Okay, so this is a standard Horizon form. Right now, it is not an ECW. If we do work with regional management, there is a possibility that we will get this into ECW for the initial phases of this telehealth. It is on paper, so this will be filled out by the usually, I guess, nurse who is going to do the telehealth consultation with the patient. So the provider will fill this out because they'll be on the receiving side of the telehealth consultation. So we will go over all of this with the nurses as well, but the nurses will have to get this filled out prior to initiating the telehealth session. I don't have to go into this in detail, but it will have all the patient demographics in here, as you can see. We will have to read this to the patient to make sure that they understand that they are doing a video conference. I would venture to say, let them know that it is not recorded because some people get weary of video recordings. So telehealth is a form of a secure video interaction between healthcare providers and patients. It may include the following: diagnosis, consultation, treatment, transfer of medical data, and education using audio, video, and other data electronic communications. By signing this consent, you agree to the telehealth process that has been explained to you. You have had the opportunity to ask questions, and those questions have been answered. You consent to engage in the telehealth consult with a provider. You have the option to withhold or withdraw my consent to the telehealth consult at any time. They will have to initial each of these sections, and then they will have to sign here, print there, date, time, AM, PM, and then the witness will have to sign and date this. From looking at this, it may need to be done each time, since the person that's witnessing or the nurse that's doing the call does have to sign and date. But we can get more details from regional management if this will have to be completed each and every time. So does anyone have any questions related to the telehealth informed consent for consultation? All right. So that was the training.
Sorry.
Go ahead.
I'm not too good with this mute button. Anyway, I did have a question. So if I'm the provider at CF and the nurse at DC is asking, they're on telemedicine and the triage, does the provider have to see that consent form? Because they're going to want to make sure it's signed before they engage in the conversation.
We'll train the nurse.
Yeah.
Go ahead.
No, I was going to say, if I'm the provider, I want to make sure that the documentation has been, before I proceed with the consult over the telemedicine, the video.
I completely understand. I'll ask that question. Since it appears that this is going to have to be filled out each time a telehealth session is completed because the witness has to sign, they should complete it there, and they could show you. They could show you right in the web session. I would show you, but I don't have my camera active. So I will write that down. Provider.
Yeah, because things can happen where it's supposed to get scanned in, it doesn't get scanned in. Now there's no documentation that there was consent provided, and I think we have to make sure all that's lined up with the provider and the patient as well, but mainly for the provider, because you want to do everything by the books.
Absolutely, I absolutely agree. If I could get my webcam working, I could show you how you could just basically visually show the provider that the consent is completed and signed, and then maybe that will be the initiation of the telehealth session. Once you have seen the signed informed consent for the consultation, once the provider sees that, then you can then start your telehealth session. But I did ask that question. I did write down Temple Health and when and how that'll be used and the expectation, and also to make sure if the locations of the current equipment will suffice for that process.
Okay, thank you.
You're welcome. So with the expectation is that we have this fully live and functional by the end of this month. It may be sooner. Tamika, do we have an actual go-live date for telehealth?
Sorry, Joe, I was on mute. I'm sorry. No, we have not. We need to speak with Tasha, Dr. Kalu, and Vandalin on when they want to go ahead and push this out. So we'll provide communication to everyone once we have that figured out.
Yes, yes, and like I said, I will email out the connectivity instructions that I provided, and if we're able to, we'll create a YouTube video, and any additional training needs that we do need to provide, we will work with all the necessary providers and nurses, but since the nurses will be on the one side of this, we do need to get them trained, and since we do have so many of them, we just have to figure out the best approach for providing them with the training, since they will have to complete the informed consent for consultation form so we can make sure there's no gaps. So we will talk with Tasha and team on the second part of training for the nurses. We'll also offer that to any providers that were unable to attend today's class, and then we will put communication out about the go-live for this. Does anyone have any additional questions? All right. So like I said, I didn't expect it to go for the whole 2 hours. So as always, my name is Joseph Marcella. So if you have any questions that you think of, everyone on this call is a Cryzen employee. You can search me in the Cryzen directory. You can call the EHR support line. You can call my desk. However you want to get a hold of me, feel free to ask any question related to this. If I do not know the answer, I will get you the answer. And in terms of Temple, Dr. D, I will work with the regional management team to figure out when we will go live with that and what we need to do to make sure that is seamless and that there's no issues with that.
Now, I have a question. I thought I waited because I thought you had more to present. My question is, after the provider has done this, where will they go into ECW? Is there an encounter, like called triage, or or is there going to be a special clinic visit type designated for this so the provider can then log off and start documenting everything? And then if they do that, the assumption would be that the nurse at the other end would be able to log on to get clinic visit type, let's say telemedicine or whatever you want to call it, then triage, and then telemedicine, and then she could take the orders off at the provider. So how's that documentation piece and the order piece for the nurse, how's that going to be done?
Well, since this is a provider and a specific nurse interaction, I would recommend using a telephone encounter because it's a telehealth visit. The provider could put their documentation in, and then they could assign it directly to the nurse that they worked with. The nurse can take off the orders, and then it could be marked as addressed. So, however, if Dr. Kalu and the regional management team would like this to be an actual visit type, maybe for tracking or reporting, we could also create a visit type. We didn't actually get that far. My initial thought was because it's a specific provider with a specific nurse that a telephone provider would suffice, but I will reach out to the regional team and ask if they would like a special encounter type for this. For this type of
reason they can put telemedicine consult or something.
Yeah, Rob could possibly create like telemed as the visit type.
Yeah, because most telephone encounters are just that. They're not, telemedicine or video. So
right.
If I'm looking at encounters and I'm trying to get an idea of something on a patient's chart, if I see telemedicine bolded, that's something I'm looking for. I can find it easier than if it just says regular telephone encounter.
Okay. I'll make sure I let them know that that the preference is probably going to be an additional visit type so that it will be very clear which encounter was a telemed versus just a standard telephone encounter.
Okay, great. Thank you.
All right. You're welcome. Does anyone have any additional questions? All right. Well, if there's no additional questions, then that would be the conclusion of our telehealth training. Thank you all for joining. I will be sending out an email with the connectivity instructions following this call. And again, any questions you may have, please feel free to reach out to me, and I will get any questions answered that you may have.
Thank you, Joe. You sounded magnificent, wonderful, and as usual, very helpful to us. We really appreciate you and your expertise. Thank you.
Thank you so much, Dr. J. I really appreciate it. And I hope everyone has a really good day today.
All right. Thanks.
You're welcome. Bye-bye, everyone.